Staff at the Comprehensive Blood and Cancer Center have collected money to send to Haiti.
We're very happy that our physicians, our staff have decided to put this money towards a better cause to relieve whatever suffering and help which can be provided in Haiti.
Physicians who can't travel to Haiti to help the injured are sending their money instead, hoping to make a difference in the name of Bakersfield. The Physicians Personal Foundation and greater organization of the Comprehensive Blood and Cancer Center pulled together $30,000 to help the survivors. But the managing partner of CBCC says even though it's a lot of money, it's the message of reaching out and sending help that matters even more.
The money is not as important as the thoughts which go behind the money. You know, me and you could be having a conversation, but I could be sitting here seething in anger and you can feel it. So it just shows that our feelings can relate to the people around us, not only nearby, but far away.
They say they chose the organizations they donated to very carefully, making sure that the most money possible is made it there to help, so it doesn't get siphoned off in other ways. All right, time for sports and a unique sports story today.
Yeah, we're leading off with CVH with something that you probably would not.
The Comprehensive Blood and Cancer Center here in Bakersfield has just announced a huge donation for the people of Haiti. The physicians and staff of CBCC have pledged more than $30,000 to Haiti relief efforts. Dr. Ravi Patel says success comes with the responsibility to help the less fortunate, and they hope the CBCC hopes this donation will alleviate some of the suffering in Haiti. Another recall alert tonight.
Dr. Ravi Patel with the Comprehensive Blood and Cancer Center is joining us this morning with some answers to some commonly asked questions about cancer. Thank you so much, Dr. Patel, for joining us.
Thank you so much.
It's always good to have you here. We have three questions to talk about this morning. The first is, does stem cell research really help cancer patients?
Yes, it does. And, you know, the controversies around what is called embryonal stem cells, that still is investigational, but there are stem cells which make your bone marrow, and therefore those stem cells are extremely useful, for example, in leukemia, lymphoma, myeloma, several other cancers. And recently, since you're pregnant, cord blood stem cell harvesting and storage also becomes quite useful.
I get more emails and letters about storing that cord blood and the benefits of it now, and that's relatively new, right?
It's relatively
Finding
new,
the benefits.
last 4 or 5 years, and the benefits are really useful on a long-term basis.
Unfortunately, quite expensive, though, too, as
Quite
well,
expensive.
right now. Hopefully
Yes.
that changes. And the second question that we have this morning for everyone is it true that watching excessive TV increases the risk for cancer?
It's interesting how studies come about. The TV itself doesn't release any toxins, but what actually happens is if you watch more than about 4 hours of TV, your risk of heart disease and cancer increases a little bit. Cancer, not substantially, but other diseases definitely. And it seems logical because if you're watching too much TV, more than 4 hours, you're sitting, eating a lot, not moving around, therefore not exercising, and it therefore increases all the risk factors. Study, interestingly, was published by an Australian magazine, not a magazine, a journal, about 3-4 weeks ago.
So we should be doing squats while we're watching this morning?
Yeah, or keep moving around.
Yeah. Yes.
If you don't use it, you lose it, you know,
Yes,
so keep moving
hey,
it.
I like that motto. Yeah, I'll do that behind the desk in commercials. Well, the last question that we have this morning, President Obama's health care plan really sparked a chord with the nation on this one. Why don't doctors discuss end-of-life issues with cancer patients?
No, I think it's an important issue, but I think the intention needs to be very clear. If you're discussing that with a patient with the intention of just saving money, I don't think it's right. The intention should be that what is the patient should be educated on the choice they have, and then it should be the patient's choice. But if you're discussing it with I definitely think it should be discussed, but from the standpoint that the patient understands what he has to do. Not from the standpoint, if your intention is I want to save cost and discuss this, it's not good.
Yeah, and you have to find out, maybe making a goal for every doctor, or that they're all on the same page, that would be easier, because sometimes it can be an individual doctor on how they see it.
Absolutely,
Yeah.
and certain older patients will do very well with treatment. We have 90-year-olds who live 12, 18 months when they thought that they would live 3 months. So, you know, it's a difference in their lives.
Yeah, and how you handle it and approach it as a doctor is important.
Correct.
Thank you, Dr. Patel, as always. It's always good to see you, and we'll see you next month.
Thank you so much.
Thank you. We'll be right back.
And we're back with Dr. Ravi Patel in studio this morning talking about cancer and cancer treatment with the Comprehensive Blood and Cancer Center. Good morning to you.
Good morning, Kiyoshi.
All right, so doctor, you get questions all the time. Let's talk about drugs, because we were just talking about this. Propecia initially started as a drug for a completely different disease.
Absolutely.
They figured out people started growing hair. They're like, hey, this could be used for, for
Hair
people
growth.
that are balding. So it's not a, not a bad thing. New usage for an old drug. Is there a new treatment available for leukemia?
Yeah, and there's a drug called Rituxan, which is sort of a targeted drug, attacks only the cancer cells. Recently, there's more and more evidence, and actually FDA approved it, for a kind of leukemia which is called chronic lymphocytic leukemia. It's a chronic leukemia, but when you combine it with chemotherapy, it's like attacking somebody from the front door and the back door. And that's how you attack the cancer cells.
Storming the castle from both ways, right,
Yes.
so to speak. Okay, let's talk about genetic testing, because this is a big issue in cancer treatment. People always want to know, can I predict if I'm going to have cancer later on in life? What's the latest on predicting cancer?
All genes, several genes either inherited or acquired drive cancer. And predicting whether you're going to get cancer is one useful use of genetics, but it also allows you to predict which cancers need treatment, which drugs are going to work, which drugs are not going to work. And that's also quite useful there.
How's the testing done? Is it a blood test?
You can do it through the blood, and you can do it through your original tissue of the biopsy, which is always stored, so you can take it, separate the genes out, and analyze them.
Oh, interesting stuff. Okay, and what's the final verdict on aspirin? Is it beneficial?
Well, the connection there is that inflammation has been associated with cancer, so there's more and more testing of anti-inflammatory drugs in cancer. And aspirin being the most common anti-inflammatory drug, people have been testing it, and recent studies show that there is a reduction in breast cancer, ovarian cancer, and earlier studies showed the reduction in colon cancer. But you have to be careful to take it because it can cause GI bleeding or bleeding in the stomach. So you should discuss it with your physician and make sure that it's not combined with a lot of other medications, and take it early.
And is it like a low dose situation? I know they talk about doing low dose for people with heart issues.
Yes,
right?
and they say you should take it for, if it's taken, the benefit is if you take it for more than 2 days a week. If you take it less than 2 days, it doesn't work.
Doesn't really help. Interesting. I'll have to do more long-term studies on that. All right, Dr. Ravi Patel, a lot of answers, a lot of questions. You always have new ones every week. Thanks so much for coming in this morning.
Thank you. Thank you very much.
Great to have you in. We'll take another quick break. We'll be right back.